This is Dr. Therese with Healthy Choice Family Chiropractic from Hudsonville, Michigan. And at our office, we have the privilege of caring for many women throughout their pregnancy and after. So, we're going to talk about some common things that we see during pregnancy and how a woman can have a healthy, natural pregnancy and delivery. So, we do commonly see women during their pregnancy having back pain. And actually, 50% of all women experience back pain during pregnancy. And that can be caused for a multitude of reasons. First, being that the average woman gains between 25 to 35 pounds during her pregnancy. With that, their whole center of gravity changes, especially as baby continues to grow. It causes the pelvis to push out and increases the curvature of the lower back. You can kind of even see that in the woman pictured there with how she's standing, how baby is pushing forward. That causes her center of gravity to move forward, causes that increase of curvature in her lower back, can give that pinching pain or feeling in that lower back as a result. Also, during the third trimester, the baby's head, when it's head down, can press down on one of our major nerves. Also, during pregnancy, our body releases a hormone called relaxin. Now, we need that hormone because it allows the joints of our pelvis to open up more and prepare for delivery. But it also can weaken other joints and cause other issues. Now, when a lot of people think of, well, I'm in pain, well, then why not just take some painkillers? Well, painkillers have been shown to cause possible issues with the baby during pregnancy. And research has just shown a clear association between prenatal analgesic use and undescended testicles in infant boys. Another study published in 2014 in the Pediatric Journal of the American Medical Association found that expectant mothers who use acetaminophen or Tylenol were more likely to have children with behavioral issues associated with ADHD and autism. Another investigation of prenatal exposure to nonsteroidal anti-inflammatories such as ibuprofen revealed that the medications increase the likelihood of physical deformities in rats. So that's where painkillers are not always the best option. We know that chiropractic care can help to relieve pain naturally. And that is because, not only in pregnancy, but also during any other time in our life, back pain is often rooted in misalignments of the spine called vertebral subluxations. Chiropractic adjustments are gentle maneuvers to put the spine back in alignment, allow the nerves to function better, and also relieve pain. Now, since the physical changes of pregnancy can cause or exacerbate vertebral subluxations, chiropractic care is ideal and safe for mothers to be. Research has also shown that chiropractic care is an effective way to reduce and relieve pregnancy-related back pain. In one trial, 16 of 17 pregnant patients experienced significant improvement in back pain after an average of 2 adjustments with a chiropractor, and none of them displayed adverse side effects. Now, women who are pregnant also often get headaches, even chronic headaches, and they can experience those for the first time while they're expecting. And this can be due to some of the structural changes that the spine undergoes during pregnancy and the increased stress during pregnancy, both physical and emotional. Even though pregnancy is a happy time overall, it still is a time where we're going through lots of life changes and hormonal changes. And that can increase stress on the body and cause more of those subluxations to occur and therefore cause headaches. We know that another effect of spinal and pelvic misalignments or subluxations throughout pregnancy is a condition imposed on the baby called intrauterine constraint. To understand this, it's important to look at the mother's anatomy and see the relationship between the pelvic biomechanics and the baby's positioning. The mother's pelvis has various key ligament attachments that support her uterus. Now, as the baby grows, their role becomes increasingly important. If her pelvis is in a biomechanical balance during pregnancy, the uterus will be supported symmetrically. This allows the baby optimal room for movement in utero and provides it the opportunity to develop free of constraint. Conversely, If the woman's sacrum, the main triangular bone of her pelvis, is out of alignment, it will affect the alignment of her entire pelvis. Misalignments of the pelvis will create an uneven pulling effect on the uterine ligaments, which explains why some women feel sensitivity on one side more than the other. Intrauterine constraint can create torsion in the uterus, limiting available space for the developing baby. This can inhibit development of the baby and of the baby's spine. Intrauterine constraint not only compromises fetal positioning, but can impair the future health of the baby. The optimal position for birth is an anterior vertex or rear-facing, head-down positioning. When the baby presents breech or posterior, it often is a result of imbalance in the mother's pelvis, forcing the baby to assume a compromised position. And we know that 1 in 25 pregnancies has a breech presentation, and that often prompts a C-section. We know that chiropractic adjustments utilizing Webster's technique helps to balance the alignment of the pelvis, which then theoretically can help to reduce that constraint on the uterus and allow the baby to take more optimal positioning. Now we know that Webster's technique, or utilizing that during pregnancy, has an 82% success rate on allowing that baby to take that proper head down position from a non-ideal previous position. Now I myself am certified in Webster technique, and I do utilize that on women on a regular basis during their pregnancy. And I do recommend that all women get their pelvis checked during pregnancy to see if they also would benefit from utilizing the Webster technique on them. So now let's talk a little bit more about natural birth. So if you are looking to have a natural birth, and we know that a lot of women are looking for that option, but they're really unsure about how to achieve a natural birth. Now, 95% of low-risk women could give birth without medical intervention, and about a quarter of them want to, but only 2% actually do. So if you're looking to have a natural birth, it is first best for you to look for a midwife, because their philosophy is a good match for women who are seeking natural birth. You can also take a class taught by a certified childbirth instructor who emphasizes drug-free birth, such as the Bradley method or hypnobirthing. Also, I recommend that all women, and this is whether you're looking for a natural birth and delivery or not, that every woman looks to have a birth plan. Now, that birth plan is just basically ideally how you want your birth to go. Also, we can talk about what you want done with the placenta. So if you're looking to have like placenta encapsulation being done, you can look in that birth plan you would want to include if you want delayed cord clamping. Also, if you want circumcision or not, if you're having a boy, if you want vaccinations right away or to delay those, all of that can be included in your birth plan. Now you're going to want to go over your birth plan with whoever is your provider, whether it's a midwife, whether it's your OB, whoever you have caring for you during your delivery. You want everyone to have a copy of that birth plan. You want to make sure that you reviewed that with them, and you want to make sure that everyone signs it so that they all acknowledge the way that you want your ideal birth to go. Also, you want to make sure to choose a support person, whether it's your partner, a family member, a close friend, or a doula, to really be there with you and support you during your birth. You want them also to know what your birth plan is, and so that they can make sure to really support you in the birth that you want. Now, having a doula to support you during your birth has been shown to decrease your risk of a C-section by about 28%. Doulas also decrease the likelihood of many other medical interventions and increase a mother's satisfaction with her birth experience. And that's why it's no surprise then that their presence being at births has doubled in the last 6 years. And if you're wondering, well, what even is a doula? A doula is a trained professional who provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth to help her achieve the healthiest, most satisfying birth experience possible. So now let's talk about some of the benefits of having a natural birth and delivery. Now, there are many benefits for both mother and baby that come along with a natural, unmedicated birth. For example, if you have an epidural, labor is likely to be slowed, which may mean that your doctor will give you Pitocin to push labor along. Likewise, if labor is induced, so if you're given that Pitocin, and your body and baby weren't ready, then you will not produce that natural oxytocin to help begin and help with contractions. You then will need more Pitocin to get the contractions going and to help keep them. Pitocin has the potential to create intense and frequent contractions that don't allow mom or baby to rest, which can reduce the oxygen supply to the baby. If the baby becomes distressed, then many doctors will recommend a C-section. That is why moms who experience induction of labor, which usually starts with Pitocin, they are 6 times more likely to have a C-section than those who don't have either interventions. Now, epidural use can also cause sudden blood pressure drop for mom, which means less oxygen-rich blood pumping to baby, which can result in fetal distress and then a C-section. Now, a C-section at times is necessary, but that's actually in only approximately 10% of births. And C-section is a major surgery for mom, and it can have large effects on the baby too. Recent research has been published in the British Medical Journal, revealed that C-section babies are more likely to develop obesity, asthma, and type 1 diabetes as they get older. We also know that C-section babies are hospitalized more often for asthma, juvenile rheumatoid arthritis, inflammatory bowel disorder, immune system defects, leukemia, and other tissue disorders during their lives. They also have a 20% higher risk of developing asthma and an approximately 40% greater risk of developing immune defects. Now, another benefit of natural childbirth that a team of researchers have recently found is that natural childbirth triggers the release of a protein in a newborn's brain that improves brain development and function in adulthood. And alternatively, the brains of C-section babies had impaired expression of the same protein. So you may be thinking right now, like, okay, if I'm going to give birth, I never thought of number 1, doing it without an epidural, right? And number 2, if I don't do it without an epidural, that's really going to hurt. Because, well, really, who wouldn't think that? Well, there are other drug-free things that you can do during labor and even before that can help with that pain. Now, chiropractic adjustments have been shown to help make childbirth more comfortable. It has also been reported that there may be a relationship between back pain and a longer duration of labor and delivery. A retrospective study that reviewed statistics of birth reported that women who sought chiropractic care throughout their first pregnancy on average had a 25% shorter labor times, and those who sought chiropractic care during their second or third pregnancy had on average 31% shorter labor times. Another study of 170 women who had experienced back pain during pregnancy who had received chiropractic care had less pain during labor. And those who were under chiropractic care during their pregnancy also have a less chance of having back labor. There are other useful methods for natural pain relief during labor, which include birthing tubs, massage, hypnosis, and that's where hypnobirthing, a birth technique, also can help with, visualization, and affirmations. So since we talked about delivery, now let's look at after delivery. So with the excitement of a new baby, it's easy to lose a sense of what our bodies have gone through and really what is yet to come. It's important to realize that after pregnancy and birth, your body will again undergo many changes. Your center of gravity will change again, hormone levels will change, your breast-produced milk and change in size on a daily basis, tissues shrink, tissues heal, and you may walk differently, and so on. Your body is considered in postpartum from a biomechanical perspective for 1 full year. That means that the relaxin hormone, which is a hormone that was released during pregnancy to help your ligaments relax, although it's no longer being produced in your body, it still has an effect on the ligamentous structure in your body. namely your joints and specifically the joints of your spine and your pelvis. With this laxity in your ligaments, you don't have the same strength in your joints that you likely had before pregnancy. This can cause your sacrum or your tailbone to still feel wobbly and unstable, your pubic bone area to be sore, and you also may fatigue easier. You may experience difficulty taking steps forward or have one leg turned out to the side. You may have sciatic pain that you thought would be gone after your pregnancy. It still may be there. And on top of that, you are managing caring for a newborn and maybe even other children too, with a shortage of sleep, no real exercise, and a higher than average stress level. Now, a failure to restore that normal biomechanics and tissue health can result in further health issues and possibly with future pregnancies too. Not only to mention, to make it more difficult to care for that newborn. Also, if you had a difficult or traumatic delivery, your spine and pelvic bones may have even more challenges to overcome. But rest assured that these challenges can be overcome. Throughout pregnancy, the birth process, and early postpartum, your body has undergone many stressful events and some type of recovery, rehabilitation to reach your pre-pregnancy state should be sought after. Chiropractic adjustments quicken recovery time and assist the body in normalizing overall pelvic and spinal biomechanics and help you overcome the postural issues created by taking care of your new baby. A chiropractor has experience and can help to guide you on the best positions to sit, tips on posture for nursing, how to lift your baby in and out of the car or crib, even how to carry your car seat. And yes, it is time that we're focused not only on the new baby, but also to remember that we have to focus on ourselves. Because to be the best mom possible and to take care of your baby the best way possible, you also have to take care of yourself to make sure that you can physically do that and that you have the energy to do that. Not only now, but for the long haul. And that's how we know that chiropractic adjustments help the mom regain that strength and mobility in her body overall. And it can also help to, halt some of those issues that they had during pregnancy and just help to make their body overall function better. So if you have any questions about how to achieve a natural delivery or about how chiropractic care can help you during your pregnancy, your delivery, or postpartum, please contact our office, set up a free consultation, and just get any questions that you have answered. The phone number here at our office is 616-426-8500. We definitely could set up a free consultation just to answer your questions, help you achieve the birth that you want, no matter if that is to have an epidural or not. Just help you and be there to support you throughout your pregnancy and after to make sure that you are bringing in the healthiest baby into the world and that you are as healthy as possible to help take care of that little one. Hope you have a wonderful day, and we look forward to helping you any way possible.